So hello and welcome back to the channel everyone. Here in this lecture we'll be dealing with one very important topic of our Neet-Pg, that is fever and rash. A lot of questions get asked every year on fever and rash because the patients that come up are acutely ill patients and presenting with some of the other eruptions. Questions that get asked on this topic range into or are expanded into various subjects. So the question can be properly from microbiology, or the question can be from the pediatric side, or the question can be just an image based MCQ, or the question can be from the dermat side. So there are a lot of questions, and also definitely from the pediatric side. So there are a lot of questions that get framed on this concept of fever and rash. We will try and understand what is asked and how it is asked and how we can answer these questions. So the two major aspects on which the question will be asked will be number one, fever, and number two, it will be on the eruptions. So fever, they will give you about the history of the fever, how the fever has come, what occurs, and depending upon that there will be a hint in the question. Second important will be eruption. Eruption is a direct hint to the answer in the question, and whenever there is an eruption we need to take care or look about some important hints that may be given in the question. Number one, there may be some medication that may be mentioned in the question. Look for the medication. Number two, look for the immune status. So these can be, rash or eruption can be an important aspect of various connective tissue disorders, various immune disorders, and all those things. Then you have look for the travel history. So they will, examiner will specifically give you some travel history to some exotic place, like for the Rocky Mountain fever, for the Zika virus, and all those questions that may be asked. Look for if in the question they are specifically mentioning about some pets. Look for if in the question they are very specifically mentioning about some prosthetic surgery or prosthetic material. So in case of SLE, then in case of the subacute bacterial endocarditis, and finally you also look for the sexual exposure. So these are some of the very important hints that may be given in the question, but to define it we need to go into more detail, and this is something which can come from the dermat side, is to defining the lesion. So they can just put up an image and ask you what is this image consisting of. So we need to understand not only the dimensions but also how these lesions primarily look. So we'll be looking into the definitions of some of the very common lesions. Like number one is, you have to look whether the lesion is a flat lesion or whether the lesion is a raised lesion. So flat lesions are macules. Macules are nothing but they change color. They are blanched erythemas. They are blanched erythemas, and these macules can be of different colors. They can be brown. So here are some of the examples where we can get these macules, like Becker's nevus. You have these macules. Then you have freckles that are there around the eyes. Then you have fixed drug eruptions. They're also brown. And finally, we have the cafe au lait spots. These are all brown macules. These are all macules that are there. Next is a papule. Papule is nothing but a raised lesion. Now, depending upon whether it is raised and how it is, if it is raised and solid, or if it is raised and flat. If it is raised and flat with a plateau like structure. So if it is less than 5 millimeters, this is a papule, and greater than 5 millimeter, it's a plaque. So here you can see in this image the papule and the plaque. So papule is round and elevated, and plaques are flat, and they often coalesce together, forming a big raised flat structure. Then you have the nodules. Nodules are nothing but rounded and they are greater rounded structures and they are greater than 5 millimeter. Then finally you have the urticaria. So here is an image of urticaria, which is also called as the wheels. They are also called as hives. As you have the beehives, so is the name given to it. These wheels can be either papules or they can be plaque. They are generally pale pink in color. Then finally you have those eruptions that have fluid in them. So you have the fluid filled eruptions that contain clear fluid. They are the vesicles, and you have the bullae. You have vesicles less than 5 millimeters. So here is the example of a vesicle, and you have a lesion which is greater than 5 millimeter. So these are the example of bullae. Obviously, when you have a fluid filled structure but that fluid is pus, it is called as a pustule. Finally, we come to the purpura. Again, in the purpura, we need to understand the basic pathophysiological mechanism that underlie the causation of this purpura. So there is a non-palpable purpura and there is a palpable purpura. The underlying mechanism of both of them is different. Non-palpable purpura occurs because of bleeding into the skin, which ultimately takes a form of a flat lesion. They can be of two types, that is patechi and ecchymosis. Patechi are less than 3 millimeters. Ecchymosis is greater than 3 millimeters. Then finally you have the palpable purpura. Palpable purpura, the mechanism is completely different. There is also bleeding, but here the primary mechanism is vasculitis. So there is vasculitis, and then followed by vasculitis there is inflammation, and as a result of that there is subsequent hemorrhage into the tissue, giving rise to the different appearance. So here you have the purpura, then you have the patechi small, and then you have the patches of ecchymosis. Finally, coming to the eruptions and defining them depending upon where they occur, they can be either central or they can be peripheral. Central, they occur on the trunk. We have different diseases very commonly asked in the Neet-Pg exam. The first one is what we call as rubeola, also called as measles, the first disease. First disease. You have very specific eruptions that occur on the buccal mucosa. They are called as the Koplik spots. What is the cause of measles or rubeola? It is paramyxovirus. Comes from the paramyxovirus family. Then you have the rubella, also called as the German measles. Here also we have spots, but the spots are on the soft palate. And the lesions are called as Forsheim's spot, and rubella is also called as the third disease. Then you have erythema infectiosum. Then you have erythema infectiosum, also called as fifth disease. Called as fifth disease. It gives a typical rash on the cheek called as the slapped cheek appearance. Rarely in this disease you also have a rash that is present on the hands and on the feet. This is called as glove and socks appearance. Glove and socks appearance. The causative agent of this disease is parvovirus B19. And lastly, we have the exanthum subitum, which is also called as the sixth disease or roseola. Roseola or sixth disease. We have to be very careful while solving the question, guys, because here are these phonetically similar words, sounding words. You have the rubella, rubeola, roseola. All of these are very confusing. Then the virus that causes is human herpes virus 8. HHV8 causes this disease. Finally, coming to those eruptions that are peripheral in nature. Peripheral lesions generally begin in the acral areas. And what are the important causative agents, or what are the important causative or diseases that lead to peripheral eruptions? They are Rocky Mountain spotted fever. Rocky Mountain spotted fever caused by the Rickettsia rickettsii. Second one is secondary syphilis. Then you have chikungunya. Chikungunya fever. Then you have the hand foot mouth disease. Hand foot mouth disease caused by Coxsackie. Coxsackie A16 and also enterovirus. #71. Then the peripheral one, the next one is erythema multiforme. Last but not the least is the rat bite fever, which is also called as Haverhill fever. So here are some of the important differential diagnosis of the central as well as the peripheral eruption. So this was a section on what we call as fever with rash or fever with eruptions and questions ranging from different subjects. So hope that this video and this topic has helped you. Hope to see you soon in the next topic. So prepare well, study well, stay focused. Thank you very much.